Uganda needs a stronger response to manage the HIV/AIDS disease, according to UNAIDS. The UN's Global Health Survey indicates the country could be slipping back in the fight against HIV, especially in young girls. In Africa, Uganda is second to South Africa in the number of HIV infections being registered in adolescent girls and young women.
Young people, especially girls aged between 15 and 24, are disproportionately affected by HIV infections. Among adolescent girls, every hour, every 60 minutes, 2 girls are infected. The prevalence among adolescent girls in Uganda stands at 9.1%, higher than the national prevalence rate of 7.3%.
Uganda registers 213 new infections every day. The UN says Uganda needs to respond urgently before the situation gets worse.
Age of sexual debut in Uganda is quite low, on average 16 years of age. But we know in other contexts it can be even lower, and it's linked also to the issue of child marriage. And child marriage is something we can deal with. We can ensure, if there is collective leadership commitment, that Uganda becomes a zero tolerance zone for child marriages.
Uganda has, however, been able to bring down new infections in babies. Its strategy of having all pregnant women tested for HIV and putting sick mothers on treatment has helped manage the spread of HIV. In the early 2000s, Uganda was hailed as a success story in the fight against HIV. But UNAIDS warns these gains could be lost.